Hey everyone, Dr. Miller here, and I am here to sort of straighten some myths that are going on around buccal fat excision. Now, for some reason, this very good operation, which isn't for everyone, but this really good operation is getting a bad rap online. Photographs like this are being shown as a really bad result for buccal fat excision, when in fact, this isn't buccal fat excision at all. I'll explain more in detail. This is basically someone who has a lot of makeup right here and is doing this. Right? That's not what buccal fat excision operation, the results that you're going to get. It's a really, really subtle result. Now, let me explain a little bit further, okay? So the buccal fat is this little fat pad right here, but more importantly, what I want you to notice is that there are other fat pads in the neighborhood. And when you do a buccal fat excision, you have to just take out the buccal fat. So I like this analogy, right? I don't know if you can see this white area over here, part of the egg, and then you've got the yellow yolk, right? But that's what it's like when you make an incision on the inside of the mouth to just take out the yolk. You're gonna see the rest of the white of the egg, and if you accidentally take out the white part instead of the yolk, you're gonna get bad results. You're not gonna get a very good result. You have to know what you're doing. Again, an example where the operation, the surgery is getting a bad rap when it's really the surgeon that's should be responsible for the bad rap, okay? And okay, what's this person's name again? You guys are all, what's her name?
Michelle Leah.
What is it?
Michelle Leah.
Yeah, it's okay, you can keep this in. So this is Michelle Leah, thank you. Okay, so this is Michelle Leah, right? And everyone's going, look at, oh my God, the over resection that she had. Again, this is makeup. You can see the lips are parted. She's probably doing this, okay? But there's something else that's really interesting. If you take a look here, look at how when you go down the side of her face, if you just keep drawing a straight line, her jawline goes in, right? Her jaw comes in. Take a look at afterwards. You draw that same line and she's got a little bulge right over here. And she's got a little bulge right over here as if she's gotten some filler here pushing this area of her jaw out, therefore accentuating the depression here on the middle of her face, giving again an illusion of what a buccal fat excision treatment cannot achieve. So listen, buccal fat removal is very subtle. I'll often do it and patients go, really? That's it? That's all I get? And I'm like, yeah, that's what a buccal fat excision is really. It gives you a very, very subtle narrowing over here, and it doesn't create that hollow look 30 years from now, and I'll explain why. Okay, it's a very subtle result, and it's not going to create this hollow sunken look that you're being seen on the internet. And here's why, guess what? Buccal fat excision is often the cause for that jowling that you see as an age, and it is the #1 procedure that facelift surgeons like myself are doing when patients are 60 years old and they're coming in for a facelift. You do a facelift, and where do you fail? You fail right around here because there's still a bulge. What's that bulge? Buccal fat. Again, the buccal fat. You need fat in this area, and that's when it all boils down to getting the right surgeon. You do need fat in this area. You have to leave all the other fat, all that white part of the egg. You just want to take the yolk. Okay, and again, buccal fat's not for everyone. I'm not saying everyone should run out and get it, but you need to understand what it is. And here's an example. This patient is my patient who had buccal fat excision, okay? Here she is before, here she is after. You can see a very subtle slimming in the middle of the face over here. It's not that drastic change. You can see instead of a curvature over here that's going on in her midface, it's a little bit flatter. It's not this drastic change. Okay, again, a patient who had a buccal fat excision. Here she is pre-op, and you can see that she's a little full. She's a little bit more pulled in over here. Before, a little bit more convex, a little bit more concave. Not this drastic change that you're seeing on the internet. So listen, I'm not telling you that the buccal fat operation is for everybody. A lot of patients come in and want buccal fat procedure, and I'm like, you're not a candidate. You don't need it, okay? But I think people need to know what they're talking about when they're discussing this operation. And some of the results that you're seeing, some of these examples that you're seeing are more makeup or lighting conditions than they are a reflection of the operation. And to prove that point, in one of my next videos, I'm going to do buccal fat excision on 4 of my staff members. And you tell me whether or not they really had the operation or not.